Let's bring in NBC News senior medical correspondent Dr. John Torres. Dr. Torres, thanks for joining us today. So nearly every state is now reporting cases of this new variant, the Mu variant. Kids under 12 still aren't eligible for the vaccine. So what do parents of younger kids need to know about this new strain, especially as we sadly hear about more children being hospitalized?
And Savannah, you're right. And it turns out to be sort of a mathematical issue here where the more people that get infected, the more children that get infected, the more children get hospitalized. And unfortunately, the more children will end up dying from this as well. Even though that's a very rare occurrence, it can happen. And the Mu variant, like Miguel said, the World Health Organization has declared it a variant of interest. The CDC has not yet. But as Dr. Fauci said, it's something they're certainly looking at as well as some of the other variants that are out there and variants that might come along as time goes on, as the months go on here during the pandemic. But the most important thing to remember is, like you mentioned, children under the age of 12 cannot get vaccinated. So at this point, the Delta variant is the one we're most concerned with. That's the one that's spreading 99% of cases here in the country. And so we need to protect them not just from the Delta variant, but these new ones that are coming along as well. And since they cannot be vaccinated, that means we need to do the other things that protect them. Adults getting vaccinated can go a long ways towards keeping them protected, making sure they're masking, making sure they're social distancing. But it's not necessarily the Mu variant, it's the virus in particular that we need to be concerned with.
So, Doctor, I mean, several public health care groups are pushing the FDA to try and speed up the approval for vaccine use in younger kids in the wake of everything we're seeing. Why is this process taking as long as it is?
So the process does take a long period of time because they have to test children. And the saying is, children are just not young adults. So you can't just take it and say, well, they're half the weight of adults, let's give them half the dose. They have to actually look at the dosing. And the younger the children get, the more complicated that gets. And so the data is coming out. They are giving the data to the FDA. The FDA is going to be looking at that. But it does take a certain period of time. And if you remember, when it came to the vaccine itself, we got the vaccine in 10 months. That was a record time to get the vaccine. And they're doing the same thing for children here. So even though it seems like it's taking a while, and we would love to get that vaccine as soon as possible, we want to make sure it's safe. We want to make sure it's effective. And that's what they're working on right now. And like I mentioned earlier, you know, the best thing, if you're concerned about children, make sure the adults around them are protected, vaccinated, and that can protect the children until we can get them this vaccine, Joe.
Let's now talk about students who are eligible for the vaccine, college students, especially as this fall semester gets underway across the country. We've already seen crowded football arenas. Several states are preventing schools, though, from enforcing mask or vaccine mandates. So how can in-person instruction, along with just college life in general, be done safely on these campuses?
Yeah, and Savannah, the answer is it really can't be done that safely until we get those measures in place. And if the students aren't vaccinated and they're living in dorm environments, they're close to each other. And we all went to college. We know what it's like. You know, a lot of after-school activities go on, especially in those dorms where you have a lot of closeness. That can cause an issue, and that can cause these viruses to spread. So without the vaccinations, without the masks, without the social distancing, that can be a problem. So hopefully the colleges, which I know have plans in order to quell those spreads, if they do happen, to go ahead and start pulling back on things, making sure that students stay in dorm rooms, making sure that if they do have these stadium events, that they limit the capacity. I think we're going to start seeing that if we start seeing outbreaks as well, Savannah.
Yeah, a lot of way after school activities that I can imagine is not super mask heavy environment. Dr. John Torres, thank you so much. Good to see you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.